Hi class, Dr. Smiley here. Uh, we are on to what you want to do, assess your patients, titrate, and administer nitrous oxide sedation. As anytime you see a patient, you must review their health history. Of course, their drug allergies, although there's never been a known allergy to nitrous oxide, their current medications, any previous adverse experiences they may have had with sedation, and just find out the last time the patient ate. It's okay for a patient to eat before inhalation sedation, before nitrous oxide sedation, just not a real large meal or a heavy or greasy meal. Of course, you want to be aware and perhaps even questioning your patients. Is there anything that about being here for care that bothers you? Have you had any negative experiences in a dental office? Or have you previously required special procedures or medications for anxiety before a dental appointment? Some offices include those questions in their initial paperwork that they have patients complete. Who can receive nitrous oxide oxygen sedation? It relates to their ASA classifications, the American Society of Anesthesiology classifications. Patients with ASA 1 and 2, yes, they can. Patients with ASA 3, they can, but you must have a physician's consultation first. Patients who are at an ASA level 4, no, they are not able to undergo nitrous oxide sedation in the dental office. In addition, there are 6 vital signs. We'll start with that. Height, weight, temperature, blood pressure, pulse, and respiration. It's considered American Society of Anesthesiology standard of care to evaluate pre-op, during or intraoperative, and post-op vital signs when administering inhalation sedation. In dentistry, the vital sign measurements recommended for minimal sedation, what you'll be administering, are blood pressure and pulse. Blood pressure, pulse, and respiration, measured both preoperatively and postoperatively. In clinic, we will be measuring our partner's blood pressure and pulse pre-op and post-op. Informed consent. In Michigan, the law doesn't mandate written informed consent. Nevertheless, it's good practice, it's prudent practice to have informed consent, an informed consent form that the patient can review, sign, date, and have witnessed. In the textbook, there is a sample informed consent form for your review. We will have informed consent document for you to complete when administering nitrous oxide at GRCC. So informed consent covers the purpose of the procedure and how it will benefit treatment. So why you're doing the nitrous oxide oxygen sedation, how it's going to benefit that patient's treatment, and understanding that there are certain risks involved with the procedure, information for the patient on the alternatives to nitrous oxide oxygen sedation, and then an acknowledgement that patient questions and concerns have been asked and have been answered. I like to ask my patients or say when completing the informed consent process, have I answered all of your questions? And then remain silent and wait for the patient to say either yes, you have, or no, can you tell me about, and allow them to continue addressing any questions they may have. Titration. This is the way we are going to administer nitrous oxide gas and nitrous oxide sedation. Titration is the administration of a drug in incremental amounts until a desired clinical effect is obtained. Titration of nitrous oxide is standard of care. This allows the specific amount of nitrous required by the patient to be delivered. And so your patient will receive no more drug, they'll receive no more nitrous than is absolutely necessary. You may have personally experienced or you may know of individuals who have experienced nitrous oxide with the fixed dose technique or the rapid induction techniques. The fixed dose technique, nitrous oxide is set at a fixed level, often 40 to 50%, and the patient is given that level of nitrous oxide to inhale immediately. That's the fixed dose technique. There is another technique, rapid induction, that pediatric dentists may use. In the right hands, in experienced hands, rapid induction works well. Fixed dose and rapid induction both, though, have a potential for oversedation because we're not determining the specific amount of drug required by that patient. With fixed dose, again, it's often delivered at 40 or 50%. And most adults, most of our patients will require a nitrous oxide concentration between 30 and 40%. Patients don't often need 40 to 50%. The average is 30 to 40% of nitrous oxide gas. So more about titration, again, provides only the amount of drug needed. It's allowing for biologic variability. What is that? No two individuals react the same way to the same amount of drug. We are all variable. Titration uncovers idiosyncratic or unpredictable reactions early. Something that you may not have expected will happen early, and you can manage that, and will minimize the patient's negative experiences, whether it is some of you or others, people who have reported, oh, I didn't like it, I felt very sick, I felt nauseous, I wanted to vomit. Those negative experiences are because of over-sedation. Patients will require different levels of nitrous oxide on different days and for different procedures. So with biologic variability, the amount that a patient would need will vary, again, from patient to patient, from day to day, based on all sorts of things. Their level of anxiety. How did they sleep last night? What procedure are you going to perform? Maybe I'm less anxious about a filling and more anxious about an extraction. What time of day it is, any kind of stress they're under. So lots of variabilities with the amount of nitrous you're going to need from one day to the next. And you'll see this too with classmates. How do you know you have sedated your patient correctly? Your patient's comfortable, relaxed, they tell you, yeah, I feel more relaxed, less anxious. You'll notice easier smiling. Now, our patients are aware of surroundings. They very appropriately respond to directions and conversations. A big clue is your patient's eyes. They become less active, less blinking, and even look a little bit glazed. Some patients may feel tingling in their hands or legs, or they might feel like their legs or arms are heavy or light. They might start to feel a little bit warm, or their face and neck may start to get a little bit red due to vasodilation. Some folks report some numbness around the mouth, but again, because of biologic variability, excuse me, the signs and symptoms are not the same in every patient. So some folks will get vasodilated. Again, face will look kind of red or pinkish, and some will not. Some will feel warm, some will not. Oversedation. It'll produce a negative experience. patients will indicate that they don't feel the same, or all of a sudden these effects have sort of intensified. We certainly don't want patients telling us they feel like they're floating above the chair, they're dissociating from the environment, they're hallucinating. That is over sedation. Lots of other things you can read here. Complaints of nausea, sweating, crying, ridiculously a lot of laughter. All of that is sedation, over sedation, excuse me. So be sure to read and notice these over sedation bullet points. So titrating nitrous oxide and careful observation of your patients are the keys to successful administration. It's all about patient selection. For dental hygienists in Michigan, it is adults 18 years or older. Someone who can willingly accept the nasal hood, leave that on their nose, able to breathe through their nose. The patient must be able to understand the treatment and give their consent to the treatment. You need somebody who's able to sit still in the dental chair. Of course, no medical contraindications that we talked about. And again, it's okay to eat, just nothing big or greasy. So prepare your patient, review that medical and dental history, introduce your patient to sedation, do your informed consent. Reasons you're selecting this technique, let them know what they can expect, that they're going to be more relaxed and more comfortable. They are not going to go to sleep. If at any time they are feeling out of control or uncomfortable, they need to let you know. You can do even a kind of a tell, show, do with the nasal hood. And as I like to do, have I answered all of your questions? I'm going to stop here. We'll start next with prepping the equipment and administering.